just underscore the importance of the vulnerability of Indigenous peoples. I mean, we need only look to some of the numbers that we're seeing with our partner to the south of us to see numbers of 3.5 to 5 times greater in Indigenous populations in the United States in terms of the impact and spread of COVID. And the impact on Indigenous peoples is devastating. That is for a number of socioeconomic reasons. And the impact on the healthcare system is correspondingly quite strong. So when we're talking about urban Indigenous populations, remote and northern populations, we need people to be focused on that. And I think Canadians expect us to be focused on those numbers and the deployment of the vaccine in order to, one, protect those populations and ensure they get first care healthcare service in a country that we pride ourselves on that healthcare service and hasn't provided it to Indigenous peoples in the past, but also in urban areas where we need the partnership with the province, and that's a hand that I extend to all premiers, and including the territories, to make sure that is deployed in a way that represents what all Canadians expect, which is a fairness in the healthcare system.
We expect in urban populations that Indigenous people, including Métis people that are living within urban populations, are treated like every other Canadian in that population and have access in an equitable way. And if I can be so bold to say, I think that is what Minister Miller laid out as the expectation for all premiers and for all provinces and territories, that this is their fiduciary responsibility, or their jurisdictional responsibility in urban centers. There is no distinction, by the way, when a person lives in a city like Thunder Bay who is Indigenous or not. They have exactly the same rights to access to care and health care as a non-Indigenous person. And so I think what we all expect is that the National Advisory Committee recommendations are applied at the provincial level and done so in a way that's equitable and fair.